Let's talk about American healthcare. Hypers in chat, if you're not American, if you're un-American, if you're some sort of disgusting other thing, let me know. Yep, right. Yes. Vile. Ooh, just. Ugh. I'm sorry. I think some of you don't really realize how bad things are here. Let me lead into it, okay? So, hi, my name is Vosh. I guess I can preempt the injury here. Back in high school, I worked out a lot. I was a big boy back in high school. I really was. And I would deadlift, and I could reach I think my max was like 365 pounds deadlift, you know? My form was pretty good too, you know? I was on the up. I was like 16, I think, 17 at my strongest. And then after that, you know, I got busier, and college, I had to commute, and I had to get a job, and I just didn't have as much time, so I stopped working out. And a little while afterwards, you know, I went to university, and they had a gym there, and I thought, like, okay, let's get back into it. This was about 3 or 4 years ago, and I deadlifted again for the first time in a while, and I was doing pretty lightweight too. I warmed up with the bar, you know, being real careful, warming up with 45-pound deadlifts, but it's good to, you know. And then I went up to one plate on each side, which is 135 pounds. And I threw my back out. I got a twinge in my lower back, and I set the bar down, and my back hurt, and I could barely walk. And the next day, my back hurt like crazy. And what followed from that was like 2 years of me being limited mobility. Kind of. It hurt to get up and out of chairs. I can still move around for the most part, but I didn't have like the money, you know, to like go get physical therapy. So I just lived with it. And for a while, you know, things were pretty bad, but you know, my back heals, time heals most wounds, and 6-7 months ago, I'm finally feeling at my prime again, you know? I'm feeling good and strong. Now, 6-7 months ago, I was in some bumfuck town in Cali. We didn't have no good gyms there. But ever since I moved, I thought, hey, maybe I'll start working out again, right? Huh? Wouldn't that be fun? And I did. And I started going to the gym again. Everything was going great. Felt good, felt strong. This time, I was really slow leading into the deadlifts. 5 days ago, same exercise, same weight. Threw my back out. Again, same twinge. Next day, could barely walk. Literally needed hyena. My girlfriend helped moving around to, you know, like holding my arm. It was really bad. I was really worried. I was like scared, you know, like, oh shit, like I fucked up the first time. I really did it twice. Jesus Christ, you know? Like, fuck me, am I fucked? Like, is this it? I'm 25 years old, you know? Am I like shit out of luck? Is it? Because you don't know. You don't know, at least not immediately, which injuries are you're going to recover from, which you're not. I'm 25 now, and that's still pretty young, but it's not as young as 21. And that's not as young as 16. The older you get, the harder it gets to recover from muscular injuries. But, thankfully, this time, I have money. Thanks to you guys. So I was able to see a physical therapist and a chiropractor. I know, don't fucking make fun. Yeah, I know, sure, whatever. I take my bone massages. Dry. It was a muscular injury. Spinal erectors. And now I'm feeling a lot better. Check me out. Wait. Look at this. Look at this youth. Look at this flexibility. You couldn't get this from any old fucking boomer. This is some top tier. Yeah. Look at that. That's pretty good. I'm only 5 days out, too. With some recovery, I've got some meds, some muscle relaxants. I'll be fine. But not everyone gets to be lucky like me. I have medical insurance because I'm 25. At 26, you get booted off your family plan, at least with the current law. But not everyone has medical insurance. Not everyone has enough medical insurance. And I thought this would be a good opportunity for us to finally talk about the American healthcare system. So I'm going to start with an analogy, okay? For everyone here who's watching who is not American, okay? The American healthcare system is one of the most egregiously unethical, inefficient, horrendous components of our society. And everyone has grown accustomed to it. Imagine hearing about some made-up country, Scotland, some fantasy country, and you're reading about it, and you read, and this isn't some like arbitrary law. This isn't some like little off in the books, dusty old like 1832 provincial code or anything. This is just out there in the open. Everyone knows it. In Scotland, if you're ever arrested for a felony crime, I don't know what their felony misdemeanor system is. If you're ever arrested for a crime, after you're sent to jail, the police, or the bobbies, as they're called, rape your dog. They just do. If you don't have a dog, they find another dog in a shelter, and they rape it. And you read it. You're reading this law, and you're thinking like, is that right? Is that what happened? And so you call up Scotland. You call a Scot, and you ask, like, is this real? And they're like, I'm not doing a Scottish accent. And they're like, yeah, mate, it's completely real. It fucking sucks, mate. Fucking when you commit a crime, they come and rape your dog. Fucking sucks. But what are you gonna do about it, huh? What's the alternative? And you think like, what happened in Scotland for the population to have grown so complacent about the dog raping? Nobody likes it. It's not like they're all getting off on the dog raping or anything. Everyone is just fallen in line and expects it. And the only people who are keeping it that way are an elite group of lobbyists who are all dog rapists. They're the ones keeping it afloat. There's just an elite cabal of dog rapists in high government that are paying to keep this in place. They just love raping dogs. They really like that. And so for that, now everyone has to have their dog raped if they're arrested. With this hyperbole thrown in front, let me talk about the American healthcare system, okay? So I'm of the impression a lot of people in my community are rather young, so I'm going to explain how everything works very simply, okay? So, there are a number of things that can happen to your body that are bad. Injuries, disease. Sometimes you need to go to a doctor or a hospital, ER, urgent care, dentist, whatever. The treatments and medicines you receive from those are often very expensive. So, to compensate for this, you purchase medical insurance. Very often, you don't purchase it yourself. It's actually provided through your employer. Your employer has a healthcare plan that they put their employees up on. That's for most people. I'm self-employed. When I get off my family plan in a couple of months, actually, I have to go buy my own insurance, which is quite expensive. And what happens essentially is now if you get injured, you have your insurance coverage to help you out. But it doesn't help you out as much as you might hope. There are two things you need to know about. One is called a deductible, and one is called a copay. A deductible is how much money you have to spend on medical expenses within a given period, usually a year, before insurance starts kicking in. So if you have a deductible of $2,000, you have to pay $2,000 to doctors, hospitals, whatever, before insurance will kick in for you. And if you end up having an expense that's more than $2,000 on its own, then you pay the first $2,000 and your insurance is applied to the rest. And insurance will usually cover a percentage of that cost. So let's say, for example, you are billed $10,000 and your insurance covers 80%. And you have a deductible of $2,000. Well, you pay the first $2,000. That leaves $8,000 remaining that insurance covers. Insurance covers 80% of whatever it's responsible for, meaning that you end up paying $1,600 of the remaining $8,000. Makes sense, right? One more thing. It's called a copay. A copay is a minimal amount that you have to pay anytime you see a doctor or hospital or what have you. It's usually something low, like $50. It's a way of preventing people from going in for a bunch of frivolous visits. You know, like it's an added tax, like a flat added fee to every visit on the account of your insurance company. Okay. So I've just described a bunch of stuff, you know, of varying interest to you, no doubt. What does all of this mean? Why is this important? Okay. Well, here's the issue. For one, deductibles in the United States are often very high, sometimes like getting up near $10,000. That's a fucking lot of money. An insurance plan that doesn't kick in until you've already spent $8,000 is horseshit. It's horseshit. What the fuck are you talking about? $8,000. Oh, I'm sorry. I thought I was getting my fucking medical coverage cut. I'm sorry. I have to pay fucking 20% of my annual income before the insurance company will even step in? The fuck are you talking? It's worthless. And then with the copays, sometimes the copays can get up pretty high, you know. And we haven't even covered the fact that insurance companies won't cover everything that you do. There are clauses for that. Obamacare fixed some of it, which lessened the number of instances in which insurance companies would deny you coverage based on pre-existing conditions. But there are still a lot of fucking ways you can get in your insurance to deny you coverage. So even if they agree to cover your shit, you still have to pay a flat amount per instance of visiting a doctor or hospital, and there's a flat amount you have to pay before insurance even kicks in, and even once you reach that point where insurance is kicking in, they only cover a percentage. And all of this in a country where the majority of Americans live paycheck to paycheck, where the majority of Americans can't even find the money to cover a fucking engine breakdown. And you expect this from them? This is insane. This is literally unworkable. The way the system functions today, it's unworkable. And there are people who are uninsured, and oh boy. Guys, everything I've described to you right now, all of it, it's an illusion, okay? Everything that I've described to you right now is the product of a game that's being played between care providers and insurance companies. And let me tell you what that game is. Let me explain to you how fucked you're getting from this game, okay? Here, let me see if I can find a Google image search result for America Hospital Birth, here, childbirth, probably, childbirth bill. Here we go. Here, this image search. Are you ready for this? My cousin's childbirth bill from the hospital in the USA. Audiology, $206. Blood, $600. Cardiology, $2,182.86. Laboratory, $31,784.26. Pharmacy, $60,637.25. Professional or physician fee, $662.15. Pulmonary services, $9,057.35. Radiology, $9,353.10. Respiratory care, $67,092.55. Room and care, $428,733. Therapy services, $99.95, for a total of more than $500,000 for the birth of a single human child. A single human child. More money than 98% of the population could pay off in their entire life. Now, it varies. Sometimes childbirth can be as low as $30,000 in the United States of America. Sometimes it can range up near $1 million. Why the variance? What's the difference? Well, sometimes there are complications, but do you really think there are any complications that justify an expenditure of that extent, especially considering the fact that 2/3 of that bill was room and board? World's most expensive hotel. Could stay at the Marriott for years on those kind of charges. Maybe a year. I don't actually know. Probably a long time, though. Do you want to know why that is? Because the bill the hospital gives you is an illusion. It's not real. The numbers are made up. I'm not joking. They are in no way reflective of the cost of service provided. And do you want to know a secret? When the insurance companies cover part of that, and that's what they're for, the insurance companies don't pay that dollar amount either. They negotiate with the healthcare providers and end up paying a fraction of the amount that you would have to pay if you dared to have a child without medical insurance. It's a lie that both of them play together. Care providers, like hospitals, give outrageously large bills because they know doing so will force people onto health insurance. You have to have health insurance. You have to in this country, or a single visit to the ER can bankrupt you, send you into medical debt for the rest of your life. And the insurance companies benefit from, because their high premiums are justified by the exorbitant prices that care providers charge for their services. Hospitals say it costs $1 bajillion to have a kid. You pull in your health care. You pay the deductible and the copay to the healthcare provider, making sure they get their fat few thousand from you. And then the insurance company will go on ahead and say, $1 million? What if I paid you $10,000? And both porkies will smile and they'll shake hands. That's how the system works if you have health insurance. You get fucked because you end up paying a percentage amount of an imaginary and exorbitantly high fee, while the healthcare providers get to reap money off of you through that deductible and copay. And the insurance provider gets to perpetuate a system where it is literally impossible to survive in this country unless you're paying premiums to them. It is a nightmare. This system of this degree of brokenness. This is like mafia running. This is like organized crime. This is like paying for protection. This is worse than our police system. Our justice system it looks pristine compared to our healthcare system. American healthcare is more expensive per capita and less effective per capita than the healthcare of any other developed country on this planet. We are the wealthiest country in the world, and we are relegated this bargain basement third world healthcare system that exists only to inflate the already multi-billion-dollar strong portfolios of executives who run healthcare and insurance companies, while everyone else gets fucked. Completely fucked. And meanwhile, the proles, so fucking desperate to keep their healthcare, and you better believe, buddy, tying healthcare a plan to your job, brilliant idea. Now you're punished for being unemployed. You want to change up jobs because you're currently working a wage slave job that makes you want to kill yourself? Sorry, buddy. You've got a recurring condition. You've got chronic pain. You've got medications you need insurance to cover part of. You can't quit. You're locked there forever. Because the moment you get a bill that isn't covered in part by your insurance company, you're dead. You're dead. This is a unfathomably bad healthcare system. It's extraordinary to me. And people will unironically go out. People who make less money than I do will go out there on the streets and demand Washington not touch it. The people who live paycheck to paycheck, who rely on insulin, anti-cancer medication, who rely on treatments for chronic back pain, who rely on medication for debilitating mental conditions, will go out there on the streets and say, we don't want Gover running our healthcare. Damn government. Government fucks up everything else it does. We don't want that. We don't want the government to be able to, say, set price caps on how much pharmaceutical companies can charge for their medications, which is why right now it is possible to pay $1,000 for a pill in America that is available for $3.99 in Canada. Every other developed country knows to do this. It's just America. It's just America. Caps on what pharmaceutical companies can charge? Well, it's not like people can just choose to die. They're going to have to pay for it one way or another. Why not just charge 100, charge 1,000? We could just charge 10,000. Why not? What's the alternative? You die if you don't have these meds. And the government's not going to stop us because the government is completely in the pocket of the lobbyists of the pharmaceutical and insurance companies, who are responsible right now for a staggering level of medical debt in this country that has kept millions, tens of millions of people in ruinous poverty, along with their children and the children after that, and so on, because of the stock portfolios, because they make a lot of money from it. A lot of money. A lot of money. An obscene amount. While people die. Honestly, I think I would prefer this system if it was a little more honest. What if they just showed up at your house with a gun, and if you didn't pay them protection, some $600 every month, they just shot you in the dick? I think I would respect the honesty of that system. And then they would charge you $100,000 for the medical care after you went to the ER for your dick getting shot off. This is unworkable. And there are two solutions to this. Actually, there are a number. I mean, policies is very complicated. But there are two basic solutions. And you see them getting tossed around a lot in the Democratic primaries. Actually, I should clarify. There are three solutions. One of them is do nothing. This is what the Republicans are fine with. Every Republican and everyone who votes against any form of healthcare reform is complicit in the misery and poverty of tens, if not hundreds of millions of Americans, and deserve every conceivable charge they would ever be levied in a crime against humanity court. But there are two solutions that get passed around a lot. One of them is providing a public option. This is something that, like, Pete Buttigieg, for example, supports. And one of them is Medicare for all, or single-payer healthcare. I don't think a lot of you know what the difference is. I'm not patronizing. I just don't think they do a good job of explaining. A public option means providing a healthcare plan run by the government to every American citizen. The option. You have the option to do so. So you can sign up for it if you want. There will still be private healthcare plans, but you can also have a public healthcare plan that is run by the government. And Medicare for all, or single-payer healthcare, which is what, like, Bernie Sanders advocates for, is the abolition of all private insurance and making the only insurance available a single monopoly provided by the government. Now, I am in favor of the abolition of private insurance because, as history has shown us, private companies will engage in rent-seeking behavior. That is to say, they will try to co-opt the authority and power of the legislative bodies that vote on legislation pertaining to those private corporations' interests. They will engage in rent-seeking behavior to try and undermine that public option. I want you to close your eyes with me and dream. Let's just all, wow. Imagine it, okay? The year is 2026. There's a public option, meaning there is a government-provided healthcare plan that people can opt into. However, the Republicans are in office, and the Republicans have every single budget proposal been slowly defunding the public option and giving kickbacks to private insurance companies who are lobbying to give money to those politicians. 10 years down the line, the public option is useless because it's been defunded to pointlessness. The premiums for the public option are too high because they're compensating for no funding from the central government, and private insurance options are the only thing that are left. This has happened in many instances. It's kind of like what the Chicago police did to the Black Panther Party. Do you want to know what the Chicago police did to the Black Panther Party? The Black Panther Party recognized one of the reasons that black kids were underachieving so substantially in American schools is because they weren't getting a good breakfast. A lot of socioeconomic reasons for that. So the Black Panther Party stepped up and they rented out these big halls, and they had free breakfast programs for a bunch of kids. Free, just you can, if you're a kid, run on in, get your oatmeal and toast or banana or fucking whatever, I don't know. And the Black Panther Party, obviously a pretty contentious organization back in its day and age, and even today, the city stepped in. The Chicago police, the city, all of them, the state, they stepped in and they said, "Thank you for making us aware of the problem, Black Panther Party. We'll take it from here. We'll provide breakfast to all of these kids. Get out of here. You're not needed anymore." A year later, there were no more free breakfast programs. The state co-opted these young, rosy-cheeked, earnest children who were just trying to get a meal in before school, and they snuffed out the program that was being provided for free by a private entity at no cost to the state. Why? Because the city of Chicago hated and hates black people. And the same thing would happen in a public option, because the politicians up on Capitol Hill, up in Washington, hate you. They hate you, they hate the poor, they hate everyone who doesn't come to their private charity dinners. They hate everyone who's not a part of the lobbying groups and super PACs that help them get reelected. They hate you every bit as much as Chicago hated black folk. So I don't think a public option would work. It's one of the reasons why I like Bernie Sanders. Medicare for all. Abolish private insurance. Why keep it? Can someone explain to me why we should keep it? Leave aside the free market for all bullshit or whatever. Why should we keep it? The insurance companies are responsible almost single-handedly for perpetuating a level of criminality and inequality in our medical system that is, I mean, this is like this is as much an extortative practice as like Caligula. The fucking, what was the Roman guy, the first firefighter, one of the richest men in history? He would go over to burning buildings and then fleece the fucking owners of the building for money before putting the fire out, that sort of thing. Crassus, thank you. Crassus, yes, my educated, historically informed chat. I appreciate it. Medicare for all. What has private insurance done for us anyway? Medicare for all. Set price caps on what pharmaceutical companies can charge. Sure, the pharmaceutical companies will now have CEOs who only make billions of dollars rather than tens of billions of dollars, and I understand that's going to be difficult for them, I really do. But when I weigh their suffering, having 2 yachts instead of a dozen, when I weigh their suffering against the suffering of the millions of Americans every day who live in fear of their own health, who live in fear of visiting a doctor because they can't afford the deductible or copay, who live in fear of getting that wart or rash or cough checked out because they don't think they can afford a doctor's visit, I really don't care that much about how much money pharmaceutical CEOs and stockholders are making. Even if you don't care about people being happy, a healthier America is a more economically efficient America. After all, most Americans live paycheck to paycheck. Most Americans aren't going to go to the doctor because they feel a weird, watery feeling at the base of their throat. Because they can't afford it. They can't take time off work. They can't do that. They can't. They have no choice but to continue working. Until it gets so bad they have to go to the emergency room. And by that point, it might be too late. A healthier America is a more economically efficient America. An America where sicknesses don't ravage entire counties because all the service workers don't feel as though missing a day off work to recover from a cold is going to fuck them. Or an America where people can actually take the antibiotics they need to keep rashes and infections from spreading to the point that they become contagious. It turns out investing in the betterment of a country makes the country better for everyone, except one very small group of people. A very elite, very secluded, very wealthy group of people who don't need to interact with us poors, who have no interest whatsoever in our well-being, who live life as a game, whose only interest is seeing their bank account grow like it's a high score in an arcade game, who need not concern themselves with the well-being of American society because they live outside of it. They live on top of it. And to any Nazbols listening, I am of course referring to the bourgeoisie, not Jewish people. Right now, anyone who isn't proposing a formulative solution to America's healthcare problems is an enemy of America, an enemy of the American people, every bit as much of a traitor to our people as a defector in a military situation would be, every bit as much as a traitor to our people as a spy from a warring nation or somebody else who made a monetary or physical effort to bring about the deaths of Americans. They are no better than terrorists. They are worse than terrorists because, to my knowledge, no terrorist has succeeded in ruining the lives of millions of people in a single signature on a bill passed down from the lobbying groups that wrote it. Bernie Sanders. My back's going to be fine, by the way. I didn't have to go to a hospital. I was careful, and I took care of myself after the injury. And I didn't have to go to emergency room. I went to urgent care, which is a lot cheaper. And I saw a physical therapist and I saw a chiropractor, and I'm going to be fine. And the only reason I was able to do any of that is because of you guys, because of your support and your generosity and your donations. For the first time in my life, I have disposable income. And that's incredible. And I was able to take care of my health. And now, when I feel sick, I don't just sit and let the malaise linger in my body. I do something about it. I can go get treatment. I can get medicine. And that's really cool.